for the invitation. It's really a pleasure to be here, although I feel very distant from the hard science that you guys do here, so congratulations. Really, it's nice to be back to academic place like this, so congratulations. Actually, your talk is going to facilitate a lot mine, so thank you very much. First, I'm going to show where I'm working to have an idea, because I can hear that now we're having a lot of lifestyle clinics just popping up like mushrooms everywhere. And at least in Abu Dhabi, what we managed to do is you need to have a very good framework to be able to apply and be recognized as a lifestyle clinic, longevity clinic. So you can scan it. So there, if you just cannot open and call your clinic as a longevity clinic, you need to have a framework, which is a good standard for maybe other countries to start. So like they like to say in the company, we are the first healthy longevity clinic that was recognized by the government there. And that's very important because you're really focused on, of course, the clinical part, but also to be connected with very good scientific minds like here. I talk about this brain and about health lifestyle, which is very simple, probably everybody here knows, but we're still not doing it. So who am I to talk a lot about this here, but I really need to point this. So we know that this immune crosstalk, so the brain and the immune system, they have a very important relation. And our blood-brain barrier, it can start to be leaking if you have chronic inflammation. So inflammation here, as we already heard, can be several things, but we know this chronic low-grade systemic inflammation is going to weaken the blood-brain barrier integrity, and this is going to allow cytokines and immune cells to enter, and this is going to trigger the low-grade inflammation. And our microglia, they are going to be very hyper-responsive, and this, with time, every single time we have an infection, it's going to trigger even more low-grade brain inflammation. We know as a risk in terms of metabolic syndrome, if you have a very poor lifestyle, that's going to be a trouble for you. But also we know that, as pointed here in one part, exercise is going to help us to regulate this blood-brain barrier. And this is going to give us a microglia balance. So a health lifestyle keeps your microglia in a surveillant but positive way, and healthy lifestyle is going to give us trouble. So we know that health habits, they are going to lower inflammation. You guys all know we are all trying to discover this. And exercise is going to help us to restore this. It's going to do an immune reset. We also know that diet is quite important, and I'm not going to bother to show how it's working here. But we have this, let's say, brain integrity model here. So structure and signaling is one part, chemical and metabolic integrity is another part, and the support and defense is another part. We know that in all those, as you can see here, in terms of synaptics, in terms of isolation, but the main goal is exercise, sleep, skill learning, this will improve. Also in the chemical and metabolic part, nutrition, exercise, we have all proved that this will also improve. Exercise, again, stress reduction, anti-inflammatory habits, we also improve in the defense. So we know all those things, and we know that lifestyle medicine can target all those three problems. Do we have any evidence in terms of humans? Yes, we have, not a lot, but we have. That was a very interesting trial, so randomized 2 years, and actually what they show us 25% greater improvement in global cognition than the control group, and a superior executive function and processing speed. We also have another study, also quite interesting, that showed if you have midlife inflammation markers 8% faster, you're going to have cognitive decline. Let's move forward for it. So the focus here, that was important from quoting from this study, is to shift from to pre-symptomatic and pre-dementia disease states and at-risk people. So not only trying to treat people that already have dementia. So these might help us. So in that finger trial, which was lifestyle for 2 years, you could see an overall 25% of cognitive improvement, executive function 83%, complex memory task 40%, and processing speed 150%. Again, those numbers, they're very difficult if you're just giving drugs to get this improvement in the patient. And that's just an example I like to give because I just received last week, let's say. That's 2 years of one patient. And this was 100% lifestyle intervention. That was, again, not against drug, but there was no specific drug. There was no GLP-1. It was just was a very tough but understandable lifestyle intervention with food, exercise, stress. And you see that was a gradual reduction. She's 74, she was 120 something. But I'm showing this, like, we know if you look to this person is going to have less probability to have cardiovascular disease, mental disease, and other kinds of disease. So we know we have this intuition, but what we want to do now, and that's what we're doing there, is we want to change from the whole person to this single cell. We want really to understand what is going on, what are we really changing in a cellular level with lifestyle intervention. So we have an example already how single cells can help us. And in this study, they improved 50,000 cells, and what they showed that aging breast tissue develops immune and epithelial signals that are very like when you have cancer. So we know how single cells are working. We know that we can try to see if they're pro-inflammatory or they're improving the inflammation markers. So for this one, actually, we paired with Singaron to understand how we're going to use, again, the single cells, because we want especially to see how our lifestyle intervention is going to deliver something, and what can we trace back to try to find a solution. What we're doing already in several stages, but this focus is especially on brain health. We want to track a lot of individuals there, and we're going to do a very comprehensive lifestyle intervention, so diet, physical activity, stress, reduction of any toxins. And our focus is really going to see, using against single cells, but also bulk RNA, how all those interventions is going to improve the immune part for the brain health. I know we are doing a lot of things at the same time in terms of health lifestyle, so it's going to be difficult to, maybe we'll try to find which intervention has a little more power, but it's not that easy. Our focus is to do the precision geomedicine. So multi-omics is just one part. We're doing a extensive assessment. We are doing several exams, and we want to actually collect all this data that we have from the clients or patients, like Brian was saying, really trying to help in discovering of a new pathway. Then we can present the data that you guys might find a solution. You might guys might use the data in a different way. That was fast. Thank you. That's the team in Abu Dhabi, and we are growing more and more. And if you guys want to know a little more, so that was a talk here. I think this podcast you all know, so it's interesting if you want to see. And that's the idea of our longevity clinic. So health and longevity medicine, population health research, and innovation hub. So that's what we're doing. Thank you.
Thank you, Thiago. We have a couple of minutes for questions, so please.
This is just kind of a crazy question, but I'm in Abu Dhabi a lot, and I feel like the government getting behind this and popularizing this is already starting to change the behavior of the population. Like, I go to fitness centers a lot when I'm traveling, and it seems like they're the last couple I've been to I can't even get on the machines. They're much more crowded in Abu Dhabi. And is there a population response already, or am I just dreaming?
Both. So we actually have a very good. We are trying to communicate better. That's why I asked the question. But we are trying to communicate better with the population, so they are more aware. But at the same time, we are still far away. Obesity is extremely high. Diabetes is extremely high. Even the policy, for example, if you are in certain stage of weight, you can just go and take your Ozempic for free, which is we can talk about it, how this is going to be. But they're really trying to innovate as much as possible and prevent. So the focus is there. The money, as you know, is there. So now is really to get the best and trying to translate this in an easy way for them to understand.
Some more questions?
Curious, how is the prescribing environment in Abu Dhabi compared to the US, for example, where it's actually very easy to get over-the-counter medications or like prescribed things like rapamycin, which are harder to get in other countries? I wonder how it's in Abu Dhabi, how the, you know.
We don't have rapamycin there, so that's so if it's not, they like to look a lot to US, for example. If it's not FDA, it's not going to be there. It's specific for this kind of. So we cannot just start a study using rapamycin. But if you have some kind of evidence, you can try to show to them, and they are quite open to try different things. We just need a nice protocol, good connection, good scientific base to show to them, and they're open to listen to everyone, actually.
Hi. So who can actually go to your clinics? Is it just Emiratis or residents, or because the UAE has a lot of transient people living there as well?
For
is
sure.
it anyone?
No. So now we are really doing studies. So we are collaborating more with the government. So it's more local population.
The Emiratis.
Yeah. And also we have a different, but we also have them. And now next year, then it's going to be open for everyone. So, but now we're really trying to understand, create the framework, and see what's working there, what's not working. And if anybody has any idea here, feel free to share. You might be able to do a study. We have a lab there, so we are very open to ideas.
Any other questions? In that case, thank you very much.